Breastfeeding is one of the most effective ways to ensure child health and survival. However, nearly 2 out of 3 infants are not exclusively breastfed for the recommended 6 months, a rate that has not improved in 2 decades. The month of August marks Breastfeeding Awareness Month, a campaign to empower women to commit to breastfeeding. Breast milk is the ideal food for infants. It is safe and contains antibodies which help protect against any common childhood illnesses. Now, women have also have health benefits from breastfeeding for a long period of time. Breastfeeding decreases the risk of mothers developing breast cancer, ovarian cancer, type 2 diabetes, and heart diseases. These are some of the things we'll be talking about in the next couple of minutes. So joining me in the studio is Bukola Olawuyi. She is a pediatric nurse, and she has been really passionate about the issue of the campaign for breastfeeding. It's nice to see you join me this morning.
Good morning.
Nice to see you.
Good to meet you too.
Great. Now, first of all, let us try to deal with some of the misconceptions people have about exclusive breastfeeding. What are those things? Can you give us some level of enlightenment?
Okay. Good morning, our teaming viewers.
We have a dolly baby here.
I have a dolly baby here. Okay. And one of the misconceptions that people have around it is that there's no way a child will feed and the baby will not take water.
Oh.
And we are saying 0 water. In fact, the team for last year says 0 water. You don't give water to this baby when the baby is on exclusive breastfeeding, in the sense that breast milk contains almost 88.1% water. And so if we fill up the baby's tummy with water, water does not have any nutrients. So that is why we encourage the mother to breastfeed properly for at least 20 to 30 minutes on each breast, so that the child can have maximum benefit of the breast milk.
All right. That's water breast milk controversy is always there. Mothers, in fact,
and they believe that the breast milk is not sufficient.
It's not sufficient.
It's not food that they cannot.
Because the way we eat and then you want to drink water. They feel it's the same.
They believe that the throat will be gumming together.
Oh yeah, exactly.
The baby will be thirsty, and so that is one thing we are trying to discourage, that the mothers should not give baby the water.
Exclusive breastfeeding. Now you have a dummy baby here. Let's talk about the process now, because that is also very important, and which is something that a lot of young mothers, even those who sometimes we assume to be very experienced, sometimes don't get it right when it comes to the process of breastfeeding. You have some things you want to demonstrate to us here. Let's do it now, so we have a better understanding of these things.
Some people have breastfed babies before, but how did we do it? That's the question we should ask ourselves.
Right.
Breastfeeding, I believe, is an act that should be learned.
Okay.
So all the young mothers should be supported.
So it's not natural because you're a woman, so you naturally should know how to breastfeed.
No. One needs to be trained, and that is where we're having problems, because most people, once the positioning and latching is faulty, the individual, the mother, want to withdraw from breastfeeding the baby.
Okay.
So if she gets it right, that is why we also talk about starting right. If she gets it right, she would be interested in breastfeeding her baby exclusively.
All right.
And so the mother wants to breastfeed the baby. She holds on to her baby this way and place the baby on the lap.
Okay.
Support the baby's back properly. The head of the baby will be in the groove of her hand, while she, let me wear the model of first.
Okay. There's a way of crossing the legs too, so
there's a way.
One lap is a little ahead of the other
to support, so that the mother does not bend and she does not have pain behind her back.
Okay.
So she places the baby this way and put the head at the groove of the curve of her hand. Support the baby properly. The baby's tummy should actually be touching her tummy. That is one way to know that she's placing the baby properly.
That's contact.
The contact must be there.
Great.
That contact must be there. So she supports the baby with the back of her hand, and she helps the baby to hold the breast.
Okay.
When she holds the breast, we have the nipple and the part of the areola. So all the nipple will be in the baby's mouth. the better part of areola will also be in the baby's mouth.
Okay.
Because the ampulla where we have the storage tank is underneath the areola.
Okay.
So if the baby is just sucking the nipple, the baby is not likely to get the milk, enough milk. So the mother we discourage this.
Okay.
Because when the mother does this, she's actually pulling the nipple backward. Instead. Backward. Right. So all we ask them to do is to support the breast from beneath, so that the baby's mouth will not be drawing down. So when the nipple is in the baby's mouth, the baby's lower lip should actually turn out. And the upper one should be firmly on the nipple, the part of the areola and the gum. And when the baby is sucking, there are times that she can actually be hearing the sound that this baby is actually gulping something. Wow. So another issue that we have is perceived insufficient milk. Most people believe that these babies, the milk is not just enough for this baby. So researchers have shown that about greater than 50% of people believe that the milk is not sufficient for the baby. Yes. But I want to tell them now, I believe that mothers too are watching, grandmothers are watching. Breast milk increases over days. Let's assume a mother has delivered the baby today. Some of them will have very little colostrum. The first milk is called colostrum. Okay. We are also advocate that our mothers, our grandmothers should not discard that first milk. It's actually the best of all the milks that is coming out, because it is a compact, dense milk with antibodies. So the mother should know that breast milk flow increases over days. It increases over days. So she's not expected. Very, very few people will deliver. On the day of delivery, we have increased milk flow. So all the anxiety around breastfeed, it's not enough. This is not, the milk is not enough. We want our mother to exercise patience. Everybody around this, the breastfeeding women should please exercise patience. All they need is support and encouragement, that they should encourage them to breastfeed. And this encouragement too, in the labor room, the baby is being delivered now to the mother's abdomen and the chest. So one way they advocate that immediately a baby is born, the baby should be put to breast, at least within 1 hour of birth. That baby, we want to initiate this breastfeeding early, because initiating breastfeeding early helps to sustain it. So we are talking about sustainability. If she starts early, she will not have any difficulty. If a woman has any difficulty, it should actually be identified at the prenatal class or the antenatal class. So that all those problems, the healthcare worker around her will be able to help her or her sister to sort it out.
Now talk to us about the issue of diet. What kind of a mother that is expecting, or an expectant mother, or a breastfeeding mother, let me put it that way, what kind of diet is she supposed to be on? Are there specifics? Okay,
there are not specific diet, but she needs to eat what we call adequate or a balanced diet. She should eat from all the classes of food. She is not eating for two, so that she doesn't get excess weight. She's not eating for two, but she's eating to have quality milk to feed this baby.
Rightly.
She should eat right. And another thing is, if she's on exclusive breastfeeding, she needs to take additional water at least 3 to 4 liters a day. Because some people are practicing exclusive, but they don't know that they should even rehydrate themselves back or take enough water. So people are not taking. So we should try as much as possible to take fluid.
So the mothers are the ones to take the water, not the baby.
It's the mother. The mother should take plenty water. She should have adequate rest. She should eat good food. She should maintain good personal and environmental hygiene. Either a woman breastfeed a baby or not. Because another issue is, I'm going to lose the shape of my breast. I want to maintain my breast. I want it to stand out. We encourage them, breastfeed your baby. When you are breastfeeding, during breastfeeding, wear supporting bra that will support the breast, so that it will not drop. So even after breastfeeding, we can also package ourselves well by wearing a good bra. She doesn't need to wash her breast on each occasion when she wants to breastfeed her baby.
Okay.
A good bath a day is just okay.
Good clarification, because this issue has caused controversy at a time amongst a couple I know, where there is the insistence of the father that since you were out, you were sweating and all of that, now that you're home and you're going to attend to the baby, you need to take your bath every time before you breastfeed the baby. Because please clarify this for us.
It's not every time she wants to breastfeed her baby she has to take her bath.
Okay.
And she doesn't need to give the breast any special attention so that she doesn't contaminate the breast.
Okay.
The father that asked the woman to go and have a bath, possibly they went to a very dirty environment.
Right.
If she does that, she can actually have a bath. But she doesn't go out, she's in with the baby, she's within her house. One bath a day is just ideal.
I see. Okay. Now, how long should a baby, for instance, you're going to breastfeed the baby now. How do you know that the baby is satisfied? And then, okay, you drop the baby. Is it when the baby falls asleep?
Okay. When the baby is satisfied, at times the baby will actually remove the mouth from the nipple. And another way is the baby will slip off. When the baby slip off, it means the baby is satisfied. And how do you know that this breast milk is okay for the baby? The growth and development. When she goes to the clinic, follow-up clinic, and the baby is being weighed, you see that the baby is gaining adequate weight. Even the mother too will know that this baby is gaining weight. So they should not expect that big baby is what we are talking about.
Okay.
Because some people
it's
not the size of the baby.
Okay.
Some people want the baby to be very big. It's not. It's not. Be a fatness or bigness is not healthy, and that is not what we are looking out for. You have a way that the baby grows. For example, a baby that is born today, if the baby has a weight of like 3 kg, by 5 to 6 months you expect the baby to have doubled the weight. By 1 year, you expect the baby to have tripled the weight. So a 3 kg baby,
so there are parameters
to measure. You have the head circumference, you have the length, you have the height, you have the mid upper hand circumference. So it is not just the fatness or the increase in the size of the body that we are talking about. So mother should, once your baby is healthy, you will also know. You will feel it. The mother is breastfeeding the baby is looking at the mother's face, the baby is smiling, playing with the mother's hair or any part of the mother's body. The mother is enjoying it, and you know the bonding is there. The bonding is there.
I see. That's really nice. Now, on the other hand too, how do you know that it is time to breastfeed a baby if the baby is not crying necessarily?
Okay.
That is, how often should the breastfeeding process happen?
Okay. If the baby is not crying and the baby is sleeping, I think the mother should let the baby sleep. But ideally, because it is exclusive and because this baby digests the milk very easily, 2 to 3 hours they should breastfeed the baby.
I see. So every 2-3 hours,
every 2 to 3 hours, mothers should breastfeed their babies.
One of the challenging things I have asked is the issue of working mothers, career women, all of you mothers in the township, in the metropolis where you have to work. There is the pressure of working, there's the pressure of social, you know, all of those things. And then there's a recommendation for exclusive breastfeeding. How do mothers juxtapose this?
Okay. You see, exclusive breastfeeding, before a mother could make up her mind, she needs to be committed. When she is committed, and she decide with the husband that this is what we want to do, she will succeed.
I see.
So that commitment, the passion to do it must be there. And so somebody needs to build up the confidence of this mother. And that is we, the healthcare worker. We are going to give her adequate information concerning the breast milk, the breastfeeding, if there's any issue, who to contact, and so on and so forth. So she needs to, that confidence must be there that I can do it. So now a career woman, when she's going, she can actually express the milk. I have so many people that have monitored and were successful in exclusive breastfeeding. Even bankers, bankers that did the exclusive breastfeeding and was successful. She actually has a they will have a fridge dedicated to the milk. So if the baby needs the milk, they are there. So after breastfeeding, after each breastfeeding, she will express and keep. Express and keep. So the more you express, the more the milk, or the more the baby suckles, the more the milk flows.
In that expression of the milk and so on, the issue of hygiene also comes in. How should they ensure that it is not contaminated when it comes to storage? Storage is another issue there. And how long should it be stored and can still be used?
Okay. Actually, even breast milk, we have some that can be stored where you have good light, good electricity supply. They can actually be stored for 6 to 9 months, some.
Wow. Where
they have enough. Okay. But our mothers, we encourage them to store, use, and restore again. They should, if there is no electricity, they can actually stand it in a bowl of water for 6 to 8 hours in a day and give to the baby. And we don't want a situation where they warm and keep again, warm and keep again. No, just take the quantity this baby needs to take at a time, and that ends it.
It has to be fresh every time?
It has to be fresh.
Oh, okay. Now, the issue of maternity leave. I see that you sighed. Now, there has been call for the review to see how we can help mothers become more dedicated and bring up healthier children with exclusive breastfeeding by increasing the time. This hasn't really gained a lot of support the way it's supposed to be. But what do you think of this? 3 months for most of organizations and even government establishments, but there's a call to raise it up to about 6 months,
6 months
and so on.
I think our legislators need to do a lot around this. Maybe some women organization can raise up advocacy program towards this. I think it's only Lagos State government and Kaduna State government that have given only 6 months. So other state government too should replicate what is being done in Lagos and Kaduna. Okay. And there should be crèches, especially the issue of working mother you talked about the other time. The mother should use a crèche that is very close to her office, so that she will not be going up and down because she wants to nurse her child.
There is even the advocacy that every corporate organization should have a crèche, no matter how small the thing is. Now, the issue of assistance to the mother, because at the time of birth, you mentioned grandmother earlier, there's the issue of the husband, we are in the African communal system where people rally around a mother who just gave birth and all of that. What roles should we be playing as daddies, as siblings, as grandmothers?
Okay. If you look at the theme for this year, I said protect breastfeeding, a shared responsibility. Everybody that is around this woman breastfeeding has a role to play. The husband will move away from the traditional role of providing food for the family to support breastfeeding. So supporting breastfeeding will not start on the day of delivery, but it is something that discussion between the man and the woman. This is what we want to do. Oh, I want you to breastfeed this baby, and this is what he needs to provide: good food, need to provide support around the house chores, and encourage the mother. Oh, my darling, you are doing it right. We need, so that this woman will know that she is not alone in the business of breastfeeding. The grandmother is there. They are also there to provide assistance to her, especially around the house. The friends will also be there to encourage her, not to mock her that, yo, this present 21st century, you are still breastfeeding. I want to tell them that breastfeeding is the best and is the gold standard. Breast milk does not have, you cannot compare it with any other thing. It is the gold standard.
All right. Thank you so much, Bukola Olawuyi, for your time on the program, and thanks for the demonstration as well. Let me see if I can hold the baby. The baby should.
You want the breast model?
No, I think just for teaching purposes and so on. Baby, how are you? It's really nice.
Thank you so much. Thank you.
This is where we come to the end of today's edition. Thank you so much. Bukola Olawuyi is a pediatric nurse, and she has been really passionate about the exclusive breastfeeding and the processes over the years. We thank her.